Primary hemostasis is basically the formation of platelet plug. So this platelet plug is a temporary plug. So, so there are certain steps in the primary hemostasis. The first is vascular injury. So vascular injury lead to the transient vasoconstriction. So it will stop the bleeding temporary. So transient vasoconstriction. So after the transit vasoconstriction, the vascular injury, the subendothelial collagen is exposed. So this subendothelial collagen is exposed. So in exposure, what happened? The von Willebrand factor that present in the Weber bodies of the endothelial cells and also the alpha granules of the platelet is released. This von Willebrand factor, then this von Willebrand factor bind to subendothelial collagen, right? So another important thing, the desmopressin. So desmopressin promote the release of von Willebrand factor and clotting factor 8. Okay, so if this von Willebrand factor is deficient, it will lead to the von Willebrand disease. So next step after the exposure is adhesion. So this platelet molecule, this platelets is adhesion to this von Willebrand factor through GP1B, right? So this GP1B, if deficient, it will lead to a disease that is known as a Bernard-Solier syndrome. So restostatin basically what it will do, it will promote the binding of the GP1B to the von Willebrand factor. Okay, so after the adhesion, so three main things released from the platelet. First is a ADP, calcium, and thromboxane A2, and many more. So, what is the role of ADP? Okay, so after the adhesion, this ADP will bind with the ADP receptor that is present on the surface of the platelet, and it will or induce the expression of GP2B3A on the surface of the platelet. So ADP induce insertion of GP2B3A on the surface of the platelet. So what does do the clopidogrel, prasugrel, these kind of the drug do? They inhibit the ADP induced expression of GP2B and 3A, right? So after that, the fibrinogen that is a soluble is bind with the GP2B3A and it will link two or more platelet together. So this linking of this platelet to one another is known as a aggregation. So thromboxane A2 that is formed from the arachidonic acid through an enzyme COX. So this COX enzyme is inhibited by aspirin. So aspirin is an antiplatelet drug. So what does this thromboxane A2 do? It will enhance this process. What process? Aggregation. So aggregation is basically the uh, linking of platelet to each other, right? So another high yield stuff is, so if this GP2B and 3A is inhibited by any drug, then these drugs are example of epitifibatide and tirofiban. So these drugs are very high yield. So if these GP2B and 3A are deficient, it will lead to disease Glanzmann thrombocythemia. So Glanzmann thrombocythemia is simply is a deficiency of uh, GP2B and 3A. So there are certain factors that are anti-aggregation factor, that is a prostaglandin I2 and nitric oxide NO. So what is a secondary hemostasis? So secondary hemostasis mean the conversion of this fibrinogen that is just soluble into the fibrin. So fibrin is insoluble. So the conversion of this soluble fibrinogen into the fibrin is known as a secondary hemostasis.